Hi, hello, namaste, namaskar, vanakkam. Good evening to all friends. We, the team Spectrum Autism, are delighted, yes, because it's delightful December, in welcoming you all to yet another special session of the Talk to the Expert series. We have with us today Dr. Koyeli Sengupta, Developmental Pediatrician at Ummeed Child Developmental Center, Mumbai. As Director, Autism Intervention Services, with over 15 years of experience in developmental, behavioral pediatrics, and pediatric mental health. Dr. Sengupta does conceptualizing, planning curriculum, and overseeing implementation and delivery of various models of autism intervention services within Ummeed, including individualized therapy services and also parent training programs. As a parent with a special needs child, I have been fortunate to have attended some workshops organized by the Forum for Autism Mumbai, where Dr. Sengupta's insights have been very useful and a valuable take home for many, I'm sure. Without any further delay, let me welcome our guest for this evening, Dr. Koyeli Sengupta.
Thank you so much, Vani. And may I say what a pleasure and a privilege it is to be with all of you here at the Spectrum family. So looking forward to our evening together.
Thank you. And let's start off the session. Can you please tell us about your work that you do as a developmental pediatrician?
Sure. As you mentioned, I am a developmental pediatrician, and at the very outset, I think this is a profession that even a few years ago, people would say, what is a developmental pediatrician? And, I think we still come by many families who wonder, what a developmental pediatrician is, and, who should they be going to? What would a developmental pediatrician contribute? So very briefly, as a developmental pediatrician, my role is to support families of children where the families have concerns about the children's development, right? So if there are any worries that my child is not really picking up on different areas of development, be it in how the child is moving, in how the child is, holding things, and how the child is communicating, socializing, in terms of picking up cognitive skills and in the ability to pay attention and studies. So if there are concerns about any one or more of these areas of development, then a developmental pediatrician is the person who can help you understand what is this child's strengths, what are the areas of challenge, and what could be possible reasons or a diagnosis that might be responsible for this. But further, a developmental pediatrician goes on to help the family figure out what resources should you go to next, who are the therapists that you should be going to, helps the family navigate, what should be the next steps, how do you advocate for your child, and then over the years, because development is not one pit stop, over the years, monitors the child's development, talks to the family about how is the child's progress, what else needs to be done differently, what else now needs to be stopped, changed. So I think that's the role of a developmental pediatrician over the years. So thank you for asking that, Vani.
Or more so, I would call you a guide, a proper guide. And now speaking about autism intervention services, what exactly comes under this AIS? Can you explain this big term in simpler words?
Yeah, sure. So I think I'll have to give a little bit of context because, I don't want people to think, okay, I'm starting to talk about some new therapy altogether. So I work at a not-for-profit organization called Ummeed Child Development Center in Mumbai. We are more than 20 years old, and we work a lot in clinical services. We do a lot of training for professionals and parents. We are involved in research, and we are, involved in advocacy. as part of our clinical services, we see a lot of families of children who have different kinds of developmental concerns, and autism is probably, a little bit more than half of the concerns that we see. Now, when we see young children, I'm a developmental pediatrician, right? And the group that I work with is mostly, we are a child development center. So we work with children. We start with very young children and do work with children up to the, early adulthood or late teens. And when we start working with children with autism, we realize at the very core, autism is not really a speech disorder, right? Autism is about social communication difficulties. And within that broad area, there are sometimes many things that children do well, and at the same time, many areas that different children may find difficult. So very often, children who've been diagnosed with autism struggle with paying attention, struggle with being able to express what they want, and at the same time, being able to understand what is expected of them, being able to interact with people, to be able to kind of be around other kids, play meaningfully with them, to be able to be independent in their everyday activities. And when we started, looking at autism intervention, we recognized that often services for autism are kind of segregated. And, there are wonderful therapists who do look at sensory needs and motor needs, be it fine motor, gross motor. There are therapists who focus a lot more on communication and speech. But somehow, it's important that we address all the core areas that together lead to the difficulties in autism, right? And we have to think about kind of a word that would pull together all of it. And so we thought about, it's a broader term. We call it autism intervention. It's a broader term. It's not a specific kind of therapy. But what is our therapeutic approach? So what do I mean by that? It's Vani, and being autism parent, I think you might be very well aware of how confusing it is for new parents, right? And with Google, sometimes it helps, but often it confuses. People are like thinking,
exactly, definitely.
Yeah.
I hear you. I understand very well.
So what do we do? What is ABA? What is this approach? What does that mean? And things like that. So yes, there are different intervention approaches, and so many of approaches are centered around what is called as a behavioral approach. But what Ummeed uses is kind of a derivation of that. So it's known as a naturalistic developmental behavioral approach, in which many of the key principles of the behavioral approaches are used, but many of the strategies are then rooted in everyday routines, in everyday play routines, everyday home routines, and teaching or coaching parents in how to incorporate or utilize or integrate some of these strategies into their everyday lives. How can they become the medium that helps their children build communication skills, build social interaction skills? So when we are working in our autism intervention sessions, we make sure that we are doing all of this, that we are using evidence-informed strategies. We are making sure that we are working through what the child likes, starting to teach to the child's likes and preferences. We work by teaching and coaching parents, and we use naturalistic strategies that can be included in the child's everyday routines. So at the core of it, this is what constitutes this broad, kind of, AIS or whatever you might want to call it. I hope that explains to some extent what we do.
Yes, you said that so well. I think I can call it everything, all these strategies under one umbrella. That is what AIS means. In my simple language, I got it like that. Am I right? Yeah. And now, how do we empower the parents with this AIS service? Because you know what happens? Usually parents get carried off with new terms. See, now you said Autism Intervention Services. So see, when you explained, it is like how I just got it. So in the simple form, So for different therapies, there are different names, and training also there are different names. Some are even misinterpreted, and often, and we parents, see, I'm also a parent, so I'm saying parents, we are so impatient. We can't wait for the results. We are saying, okay, I do one named therapy A or therapy or training B, whatever I'm doing. I want, or rather I wish for, what do I wish for as a change, as a result? Like it's like an exam. See, I go for a therapy, I think, okay, it doesn't happen overnight. I have learned over the years. But for a new parent, they're saying, I'm doing AIS, I'm doing this training. What do I actually expect? Or what are the changes, associated differences that parents can look out? Just in general. Can you explain
Yeah,
that?
yeah. Vani, you say something so important. I think we want to acknowledge that all parents hope for the children to do the best they can, right? And I think I just sometimes tell parents that, it's sometimes hard because the rate at which our children may make progress may not be the same as the rate that we wish for them to make progress. And to acknowledge for ourselves as professionals that this is a journey that both are making, the parents as well as the children, right? And it's a journey where everyone is learning together. So, and it's also, I think, important for us as professionals who are working with parents of young children to be able to demystify what is it that they should be looking for. So, for instance, very often we will see or we will meet parents who, after their diagnosis and after starting therapy, will come back after 4 months and be very sad that, doctor, but now the child is still not talking. He or she is not talking. I see a young lady trying to join the call, so of course we should say hi to her. So, yeah. Where parents get very worried that, we've started therapy, we are going twice a week or thrice a week or whatever it is, but the child has not started talking yet. And I think that's where it's important to understand that development, after all, is a process. And that's why I focused right in the beginning on saying that we are not, autism is not a speech delay only, right? There's so many things that provide a platform on which we need to build communication. What are those prerequisite skills? The ability to be able to pay attention to other people. So parents will start noticing that now the child is more aware of, when new people come in or when we are trying to do something with them. There's a necessity for the child to be engaged with the parent. What does that mean? It's not about forcing a child to do an activity, but when the caregiver or the parent, are doing something together with the child is paying attention to what's going on, is interested in it, shows the parent, yeah, I'm having fun and I want you to keep doing more. Attention, engagement, these start off, and then we are able to see slowly communication building. And communication, once again, has two parts. I always keep emphasizing that parents have to recognize that children just don't speak. They need to be able to understand what is being said to them. They need to understand what are the messages that are coming to them from the environment. And at the same time, being able to express themselves, initially maybe by reaching out, by making a choice, sometimes by pointing, and then slowly connecting the sounds to the words and then building on it. So speaking just doesn't come by suddenly. We lay on these layers so that parents are then able to see, okay, this is how the changes happen, this is how development progresses.
So the little clues are important. That is what we parents have to look out for.
Yes, and I think it's important for us to help parents see these changes, right? How will parents know? I mean, it's we've been trained in it, but it's our job to help parents understand how development progresses and what's their role at every single step. And that just because a child is not speaking doesn't mean that the child is not making progress.
So the changes in communication, once communication starts stabilizing, we should treat it as a clue that something is working, more than expecting the child to say my name, what is my name, and all that. It's a rather that type of
yes. It's communication is so much more than just speech.
Okay, that was so wonderfully explained. Thank you. And what do you think is neurodiversity, and how do we create the awareness about it? Many people don't understand that term, neurodiversity.
Well, I mean, once again, it's a fairly newish term. I think, the term neurodiversity was coined by an Australian sociologist called Judy Singer in the late 90s as part of a thesis. And I think what it means at the core of it, I mean, that too different people interpret it differently, is the very simple premise that like every person is different, all brains are different. And all of us lie along a spectrum of diversity. All of us think, behave, act differently. And that differences are not necessarily deficits. And to acknowledge that while there might be norms or typical ways of being, but there are many who think differently, act a little differently. And that's not necessarily that a difference is a disability. So that's the underlying idea beyond neurodiversity. But often neurodiversity, so is used in the autism context, and I think I was reading a little bit about how Judy Singer says it, and I think she said it interestingly. She said, "I'm not quite disabled, and I'm not quite mainstream," and I think in a way that's how she looked at neurodiversity. But what it also means is how all of us as a society look at disability, right? And that disability or diversity exists in every single thing. And for us to be aware that there will be children, there will be individuals who probably communicate in different ways, who respond to situations in different ways, who may seek friendships, socialization, or not in different ways, and that it's okay. And I think that's the awareness that slowly will have to come in. The awareness that differences are not necessarily, are not wrong or not gaps, right? It's a movement that's slowly taking on much and greater momentum. There is a push for being able to use language that is respectful of all, respectful of differences, and I think it's something that's only going to grow stronger in the years ahead, and it's much overdue, long overdue.
I just like the way you said that, differences aren't deficits. I like the way that line was very touching. I liked it. And there's a question from the audience. Dr. Janaki Ramanathan has asked. She wants to know what are the myths and facts about therapies that parents need to know. That I think you already said that right now.
Yeah, myths and facts. Well, so many, right? I think one of the strongest myths is, I mean, how do I say this? Therapy is is not the only way or not the only medium that, or just doing therapy is not going to be enough. Therapy is something that facilitates progress. Therapy should be something that facilitates caregiver understanding of how the child communicates, behaves, and what could be helpful to, bring the child to or the individual to a place where there is comfort and where there is better ways, optimal ways of communicating and being. Therapy is not meant to make a child normal. That's not the idea. Therapy is not a way. The idea is not that, if you go to therapy, the child will no longer be autistic. That is not the point. We are not trying to throw out autism, but every person, every individual has the right to being accepted for who they are, to being able to work towards their potential, to be able to use their skills and their strengths to live meaningful lives and be able to participate in all that they can do. And therapy is a vehicle to enable that.
We can call that as a catalyst.
Yes, absolutely. I think what a powerful word, Vani. It's a catalyst, but it is not the only thing.
It's not a cure or something like how
absolutely
people advertise.
Yes,
we can call it a
yes.
catalyst rather than a cure.
Yeah, totally. And we are not working towards a cure, right? It's not a disease, so we are not working towards a cure.
We're not working towards a cure. Yeah, definitely. Yeah. And there is an appreciation for you from Miss Gunjan Srivastava. She's admiring Dr. Koyeli as she helped them understand the difference between speech and communication, which helped them understand their child immensely. Thank you, Gunjan. Thank you so much.
Thank you so much. And I also want to point out the huge role that parents like you all are doing, like, Vani, like you, like Gunjan, and what it means for you all to share your journeys with other parents. Because, if I loop back to what we do as part of support for parents with of children with autism and other disabilities, we recognize that just therapy centered around, communication and social skills is just one part of it, but that it is autism impacts the family, and that we need to work on parent caregiver mental well-being, on initiatives that help both parents and children to be part of, leisure activities, to be part of fun activities, to help them access and coordinate different services that are required, and that together, all of this constitute services that families should be able to access.
Definitely, because learning should be fun, especially for our children. It shouldn't look like you're getting it from the book to the brain, I go with you for that as well. And having said all this, what will be your message to society, the role of community, and how important it is to support the parents of the special needs children? Now you said for the children and the parents. What is the role of the community? How could you just put it in words?
Huge, right? I think it starts right from the time that I think parents are able to pick up that we're noticing that probably our child's communication is different, or the child's way of responding is different. And often the messages that they receive from the community are, oh, you worry too much, or, just give time. And I think the message that the community, the immediate community around the caregivers, has to acknowledge parents as the experts on the children, and to validate and listen to the parents, and to help them provide or find the supports that they need, and not hold them back. The second step in which community can be helpful is everything is part of community. Schools are part of communities, right? So how can we have inclusive schooling systems where children, their strengths and difficulties are equally acknowledged, and that every child has the right to learn. Children, all children, autistic or otherwise, need to be able to access public spaces. They need to be able to go to parks and to be able to go to malls and to be able to cycle in the ground outside. And for, other people in the neighborhoods to know that, here's a child who wants to play. And maybe his or her play looks a little different. And maybe when he or she gets excited, their behaviors may look a little different. But let's support the parents here and the child, and because we are all part of this, right? To stigmatize less, to accept more, to judge less, and to be more open. I mean, it's so important for our communities to be able to do that.
Absolutely. You said that so well. Thank you so much. Thank you so much. And then finally, your message. You're saying that so well in simpler words. As a parent, I am overwhelmed by what you're talking. I hear you as society more than a doctor, as a friend. I want you to put your message to the parents and the therapists. Maybe I can call it your tips or your advice. You said for society, now tell for parents and caregivers and therapists.
Wow. Okay. I'm not going to call these as tips because I don't think I know enough to share tips. There's so much more to be known. I'll share a few beliefs, work beliefs that I have incorporated as part of this wonderful organization that I work with, and where we truly understand and value that parents are the experts in their children's lives, and to value that parent intuition, that parent knowledge about the children is so important. And that as professionals and therapists, we have a collaborative role to play. It's not about, okay, I'm going to tell a parent, you go home and do these two things, and then step back and be very judgmental, oh, that parent didn't do anything. But to be able to be able to meet the parent where they are and to be able to figure out what's really going on. Why are things difficult or different? How can we together work towards what looks like, what looks possible to make this child's journey better and more productive? So I think to look at the professional parent relationship as one that is collaborative and not one that is just, expert and here's a parent who knows nothing. And for parents to have belief in themselves, to know that they know their child well, to trust their intuition, go out there, seek information for yourself, and seek support. Always, I think there is strength in seeking support for yourself.
Thank you. That was such a wonderful session. I think I really enjoyed chatting with you. It was not like talking to a doctor, really. But whatever you have mentioned, I think I have taken a lot of insights. I just loved it. And I think the audience would also be very happy, and a lot of information from you from this half an hour. And it was very informative, Dr. Sengupta. I'm sure, whoever is watching, it must have been very useful. And we at Team Autism Spectrum Autism are grateful to you for sharing your insights and facts and for taking the time off for this session, in spite of not being so well or very well. Wishing you good health, and thank you so much, Dr. Koyeli Sengupta. Thank you so much. Wait, everybody don't go away. I'm sure it was a very useful session to parents and everybody else watching. And then we actually sign off with our motto and pledge. We pledge to be inclusive and accept the unique. And this is one more information I'm very happy to share with you all that on Sunday, 18th December, evening after 7, please stay tuned to our FB page. There is a musical extravaganza 4.0 where We are actually going to have an inclusive program where kids from both neurodiverse and neurotypical and their parents are going to all surprise you with some fantastic music. Please join us all and support the kids. Thank you. Have a wonderful evening. Have a wonderful weekend. Thank you so much.
Thank
Bye.
you.
Thank you.